I'm Shannon Goldman from AgSolutions Australia, and in 2017 we held an equine nutrition seminar with the keynote speaker being Dr Nerida Richards from FeedXL. The following video was filmed during this event and it features Nerida discussing Bighead and the disease progression.
Okay, so Bighead disease. I see way more than this than I'd like. So horses grazing high oxalate subtropical pastures, including Kaikui, buffalo and Soteria, are at risk of bighead. So the calcium in these pastures is largely bound by oxalate. So oxalate is just a little compound. It's in a heap of stuff. Like, anyone eat sweet potato this week? You've eaten oxalate. So it's in strawberries and in a whole bunch of foods that we eat. But the calcium in these subtropical pastures gets bound up by oxalate, and once it's bound by oxalate, the horses can't absorb it, so they become calcium deficient. And they can absorb a tiny little bit of calcium oxalate, but even if it's in their body, it's useless to them because it's not calcium to be used as calcium, it's calcium oxalate. So Bighead is correctly known as secondary nutritional hyperparathyroidism. There's a very good reason why we don't use its correct name, but essentially it's just a severe calcium deficiency. And it probably more correctly should be just called osteoarthritis, what's it called? Osteoporosis, so loss of mineral content in the bone. To maintain blood calcium levels on a calcium deficient diet, horses have to pull calcium from their bones. So we're going to do a little bit of a demonstration on how this works. But essentially a horse's blood calcium level has to remain exactly the same all the time, because calcium in the blood is responsible for your heart beating properly. It's responsible for your muscles contracting properly. It's responsible, it have functions in your brain. It has functions pretty much anywhere. And if the calcium level falls out of the really, really strict range it needs to be in, there's a whole bunch of hormones jump into play to make sure that you absorb more calcium from your diet. So one of those hormones is the parathyroid hormone. So as soon as, and it happens like really, really quickly in the body, it's pretty amazing. As soon as the body detects that calcium levels have dropped a little bit in the blood, this parathyroid hormone is released, and the body starts to, like, it creates more active vitamin D, and it will suck more calcium in from the diet and get that blood calcium level back to where it should be really, really quickly. So when the full name, the hyperparathyroidism, is just saying that for nutritional causes, the parathyroid hormone is really, really elevated because they're so calcium deficient. The body's basically panicking, going, "Oh, I need calcium," and it just keeps that hormone really elevated. So eventually, to keep the blood calcium level the same all the time, the only place, if it can't get it from the diet, so if the horse is eating subtropical grass and it can't get the calcium from the diet, it goes to the bone, because the bone's got a massive amount of calcium, and the calcium in the bone is always fluxing in and out. That's very normal. But what happens is they pull too much calcium from their bone. So eventually, because the blood is constantly saying, "Can I have some calcium? Can I have some calcium? Can I have some calcium?" They pull so much calcium from their bones that their bones become brittle. And unfortunately, a lot of the time, the first symptom we see of bighead is a horse with a broken leg, and it's often just put down to bad luck. That the horse broke its leg, but I really don't think many horses break their legs through bad luck. So in young horses, the horse's facial bones will expand, and that's where it gets the name bighead, and they get that characteristic bighead appearance. So they can have a head like this one, where the most of the expansion is out the side. It's also very common to see them with a ridge between their eyes. That's the other really common expansion of bone in bighead disease. So a shifting lameness is a common symptom. So you'll get a horse, because their bones are becoming quite brittle, they're also becoming quite sore, and you'll find that they'll be lame, say, on their near side front leg, and so they'll favour that leg and use the other front leg, but then that one will become sore, so then the lameness will shift to the offside front leg, and then it'll shift to the back, and it's this really weird. The horse seems sore, it's not quite itself, but you can't ever really pinpoint where the problem is coming from. It's this real shifting lameness. When they get pretty bad, they'll often lose weight, and their hair will get quite rough, their coat will get quite rough. They become agitated and sore to touch. So I've had ponies, there's one pony we recently dealt with down in Victoria that was on Kaikui, and he was getting massaged every week because he was so sore. The poor little guy had bighead. And the vets had like you had the roaring sound when they breathe, which is a symptom as well. And the vet had diagnosed him with some allergy, and so he was being treated for muscle soreness and allergy. He had Bighead. Their behaviour changes. This is a massive one. So has anyone noticed this with their horses with Bighead? They get nervous, they get aggressive. Anyone notice that? No, you're going to all make liars of me. Thank you very much. But a lot of the horses I see that are, they're in a pretty bad way, but they're nervous and they're aggressive, and they're not the way they would normally behave. They develop these loud breathing sounds. So again, this is when they're quite progressed, but it's because the bones in their throat latch area have expanded because they've lost so much calcium. They puff up, and then it puts pressure on their airways, and they make these funny noises when they breathe. And if really severely calcium deficient, so when they get to the point where the blood's going, bone, give me some calcium, and there's none left to give, they'll actually go down. They're like a downer cow, or a cow with milk fever, because they just can't maintain their blood calcium levels. It's pretty bad when it gets to that point.